Hello everyone, we're here on our fourth part of our talk on PRP injections, and we were talking about Lonzo Ball and his left meniscus injury. I'm here speaking with my sister, Dr. Moheimani. Go ahead, Dr. Moheimani, and continue your talk on Lonzo Ball.
Yeah, so where I was kind of talking to in the previous video, one of my inspirations for doing this talk was Lonzo Ball's situation. This past summer, he had a meniscal injury, and then there was this whole idea that perhaps that information had been leaked so that they wouldn't trade him away over the summer. And the cool thing is that he did end up doing PRP for that injury, so I was very curious what the literature was and whether or not there was good studies that kind of supported the idea of using platelet-rich plasma to treat a meniscal injury.
Okay, and I'm going to assume, because he's been playing pretty well, so I guess it's been a success? I mean, he has kind of been injury prone, but he's been okay, right?
Well, actually, what ended up happening was he had the injection, he was out for a couple months, and then they weren't actually happy with the results, so they did actually end up doing surgery for him. So it did not necessarily give him the exact results he was looking for. But granted, you know, he's kind of a special situation because the kind of activity that a professional basketball player has, they didn't really give him that much time to rest up. So that may have been why he didn't have the same efficacy.
I see. Okay, and then do you want me to move on to the next slide?
Sure.
Okay, so back to basketball activities after PRP injection.
Yeah, so so it did work initially. I mean, like I was saying earlier, he was back to playing. You know, they had just a short time after having playing. I think that there was a chance he actually may have even re-injured it. That's why I'm saying it's kind of hard to say if the PRP failed or if he overexerted the knee in his recovery time because of the demands of being an NBA basketball player.
But he's healthy and playing now, so
right.
Overall, but he had to get the surgery, so you're thinking that the surgery kind of got him back to the 100%?
Yeah, and it kind of just depends because the other issue is that if he was having instability, so a lot of this stuff is kept confidential, so it's really hard to know exactly what's going on, but they did do the surgery, and it may have been, maybe he did have some instability and that's why he had to do surgery. But in general, he did have the injection. He was doing better at one point. He was back to training, and then something along the line pushed him to do the surgery ultimately.
Okay. And I'll move on to the next slide?
Yeah, let's go for it.
Okay. Plasma-rich, or platelet-rich plasma injections. Go ahead.
So I'm going to review exactly what PRP is. So what they do is they draw your blood, they put it in a centrifuge, they extract the part of the blood that's rich in it's called plasma, the plasma that's rich in the platelets, and then they turn around and inject it. In this picture, it's a shoulder injection, so maybe for like a rotator cuff tear. And the thing with this is that cost is a big reason why people don't do PRP, because there are people who charge a lot. But to my knowledge, you know, our father, Dr. Mike Moheimani, has been doing these for a pretty good price.
So there you go, guys. If you want to fly out to Orange County / LA and come get some PRP treatments, you'll get great pricing.
And I know that, you know, in LA, because that's where I am, a lot of patients have told me or quoted me that people are charging, you know, $2,000, $3,000 for a PRP injection. And I know one patient that was really happy with his injection for his knee, but he just didn't have the money to get the other knee injected. And in my mind, I was thinking with that $2,000, I think he probably could have gotten both knees injected at Coast Spine Sports Medicine.
Yeah, and let me ask you this too: is in the future, shouldn't, like, if you have a PPO insurance, they should eventually cover it, right? We're not too far away where insurance companies will start having enough literature to cover the cost or at least subsidize some of it.
That's a great question. It's really hard to say. There's a lot of politics involved with insurance. I would have to believe eventually it will be covered. They just started recently covering hyaluronic acid, which is another injection that people do, also known as Monovisc and Euflexa. So I imagine over time that the PRP part will be included eventually.
And this should save the insurance company money, right? Because a PRP injection, especially the way they gouge people and bring down the pricing, it's going to be cheaper than a surgery and less downtime for the patient, correct? So in a way, they would save money if the PRP works.
Yes, absolutely. I do think it could be cost effective. Again, like I was saying, we have to kind of see what happens, and there's some politics involved, but eventually that is probably the future.
Okay, so you heard it from the good doctor that hopefully PRP will be eventually covered, and I definitely recommend you should price shop if someone quotes you $2,000 an injection. Maybe you can find other physicians that will do it for less. So we're now on to the next slide, the case report N1. What's going on here?
So for our non-science friends, case report is a study where you just look at one person. So N equals one person we're looking at. So some of the, very preliminary literature on this topic of a meniscal injury. So basically there's a patient that was 29 years old. She had a non-traumatic injury. So probably something degenerative pain, from her knee. They tried this HA, which is hyaluronic acid, which I was talking about previously. And they'd even done some surgery where they kind of like shaved her meniscus down. And then they did the injection and she actually got better. There's another case report, again, so sample size of 1, of a 43-year-old guy. He had a grade 3 tear, which was the one that we were talking about earlier. Like grade 3 is one of the higher end grade tears. And he also reported that he had 3 injections of PRP within a month time span, and he had resolution of his pain. These are all studies looking at degenerative injury to the meniscus. And then the image to the right of the text is basically showing that with the PRP, you actually can see on MRI the lesion gets better over time, which is kind of exciting stuff. So you're seeing some healing that's going on.
Okay. And if you don't mind, can we go ahead and move on to a new clip, or do we need to stay on one clip for the next slide?
Whichever you prefer.
Okay, so we're going to go ahead and end this, and we will move on to part 5. Thank you for watching, guys.